This medication is used to help treat multiple sclerosis, MS. It may help to slow down the worsening of the disease and decrease flare-ups of symptoms, such as balance problems, numbness, or weakness. The daily dosage and the optimal timing for taking Rebif Syringe will be determined by your doctor based on your specific condition. Before you start using Rebif Syringe, make sure to read the medication guide and instructions for use provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. If you are using this medication at home, learn all preparation and usage instructions from your healthcare professional. Before using the medication, check it visually for particles or discoloration. If either are present, do not use the liquid. Learn how to store and discard medical supplies safely. To increase comfort, remove the medication from the refrigerator and let it warm to room temperature for about 30 minutes before injecting. Do not warm it in any other way such as heating in the microwave or placing in hot water. Inject this medication under the skin as directed by your doctor, usually 3 times a week, at least 48 hours apart. It is best to use this medication near bedtime to reduce side effects. Before injecting each dose, clean the injection site with rubbing alcohol. Change the injection site each time to lessen injury under the skin. Do not inject into skin that is red, sore, scarred, or infected. Inject this medication in the thigh, abdomen, buttock, or the back of the upper arm as directed by your doctor. The dosage is based on your medical condition and response to treatment. Your doctor may direct you to start this medication at a low dose and gradually increase your dose to reduce your risk of side effects. Use this medication regularly to get the most benefit from it, and use it at the same time for each scheduled dose to help you remember. Tell your doctor if your condition gets worse. If you experience pain, redness, or swelling at the injection site, make sure to inform your doctor. When you first start using Rebif Syringe, you may experience flu-like symptoms such as headache, tiredness, fever, chills, and muscle aches. These symptoms usually improve or go away after a few months of continued use. To lessen these side effects, you can inject the medicine at bedtime and use fever reducers/pain relievers such as acetaminophen or ibuprofen before each dose. It's best to consult your doctor or pharmacist for more information. It's essential to remember that this medication has been prescribed because the benefit to you outweighs the risk of side effects for most people. However, if you experience any serious side effects such as mental/mood changes, feeling too hot or cold, easy bleeding/bruising, joint pain/swelling, signs of kidney or liver problems, or new or worsening symptoms of heart failure, it's crucial to contact your doctor right away. Rebif Syringe may lower your ability to fight infections, making you more susceptible to serious infections or worsening any existing infection. If you notice any signs of infection such as sore throat, fever, chills, or cough, be sure to contact your doctor. While a serious allergic reaction to this drug is rare, it's important to seek medical help immediately if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed above. Before starting Rebif Syringe, it's important to let your doctor know about any allergies you may have, as well as any medical history of bleeding/blood problems, heart problems, liver disease, mental/mood disorders, seizure disorder, or thyroid disease. There is a small chance of getting infections from the medication, although the blood is carefully tested, and the medication goes through a special manufacturing process. It's important to stay away from anyone who has an infection that may easily spread, and to consult your doctor if you have been exposed to an infection. If you are using Rebif Syringe, it's important to let your healthcare professional know before receiving any immunizations or vaccinations. It's also important to avoid contact with people who have recently received live vaccines. During pregnancy, Rebif Syringe should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. Additionally, this medication passes into breast milk in small amounts, but is unlikely to harm a nursing infant. It's important to consult your doctor before breastfeeding while using Rebif Syringe. It's important to be aware of any potential drug interactions when taking Rebif Syringe. Certain medications may affect how Rebif Syringe works or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial to never start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of Rebif Syringe. Always consult with your healthcare provider before making any changes to your medication regimen. If someone has taken too much Rebif and has severe symptoms like passing out or difficulty breathing, it's important to seek emergency medical help by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. It's important not to share Rebif Syringe with others. While using this medication, it's important to have regular lab and medical tests, such as complete blood count, liver function, and thyroid function tests. Make sure to keep all scheduled medical and lab appointments. If you forget to take a dose of Rebif, you can take it as soon as you remember, but then skip the next day. It's important not to use this medication 2 days in a row or to take a double dose to make up for a missed one. Just follow your regular schedule the following week. Remember to not make up for it by taking 2 doses on the same day. The recommended dosage is typically 3 times a week, with at least 48 hours between doses. It's best to take Rebif at the same time on the same 3 days each week. This will help you remember and keep a consistent level of the medication in your body. It is important to store Rebif Syringe in the refrigerator away from light, but do not freeze it. You may also store it at room temperature for up to 30 days, but refrigeration is better. Remember not to store it in the bathroom and always keep it away from children and pets. When it comes to disposing of Rebif Syringe, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard this product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.